Is it working?
Yes.
Wonderful. All right, I'll make it bigger so folks can see. And I'll when we start, I will walk through this agenda on the record. Although it's hard for me to see when I screen share how many people are here. So, Desiree, do we have a good number of members here?
Yes, Mr. Chair.
Okay, great. Then let's go ahead and the recording's on. So I'm going to go ahead and call this work session to order. The second work session on the alcohol tax. Let's start with a roll call.
Mr. Rivera?
Present.
Ms. Quinn Davidson?
Here.
Ms. Allard? Mr. Constant? Mr. Dunbar?
Here.
Ms. Kennedy?
Here.
Ms. LaFrance?
Here.
Mr. Perez-Verdia? Mr. Peterson?
Present.
Mr. Weddleton?
Here.
Ms. Zalatel?
Here.
We have a quorum.
Great. Thank you, Desiree. So as usual, if you want to get in the queue, feel free to put yourself in the chat or text me if you can't access the chat. Just as an FYI, until I stop sharing my screen, which I will do soon, I can't see the chat. So I'm going to go through the agenda and then I'll stop sharing my screen. So for today's hour and a half, so for today's hour and a half, which I think actually got cut down 10 minutes, but that's okay, we'll make it work. So we are going to, the administration is just going to do a simple quick overview of the initial alcohol tax plan that was presented in May, just as a quick reminder to ourselves and the public of our starting point. Then from there, we will go through 4 different presentations. I'm going to ask that we save our questions until the end of all the presentations. We have plenty of time at the end for discussion. So health policy is going to go first, then the Assembly Committee on Homelessness, then Public Safety Committee, and then we have Recover Alaska and the Coalition, / the Coalition. Each of them is going to be 10 minutes, and then from there, the remainder of the time will be discussion. And, if we can get to it, which I really hope we do, because it's going to help me plan the agenda for the August town halls, discussion and compiling of 1 or more draft plans to present. And I'll talk about that more when we get to that item. So with that, I'm going to stop screen sharing. And then I will turn it over to, I think, Jason.
Thank you, Mr. Chair. Let me try to share my screen now, and I will run through the Excel document really quickly that I think we presented back in May. All right, can everyone see that?
Yes.
Yes.
Yep.
All right, so this was I guess the kind of starting document that we presented back in May. It was slightly different from, I think, the version that the Assembly and the public saw in January when something similar was presented. And I'll run through kind of what those very slight differences are. Essentially, about 500,000 was removed from the public safety bucket and was put into the child abuse, sexual assault, domestic violence prevention programs bucket, so that each of those buckets would be equal at about 3.6 million each. But as I run through these, public safety, there are additional sworn and non-sworn. On the criminal justice personnel, that would be additional prosecutors and public defenders. And then the expansion of the core team made up the public safety bucket. And then generally, The evidence-based grants to providers and early education grants made up the second bucket. And then the final one, the final large bucket, is the substance treatment and prevention programs. There was about 4.6 million, about 2 million that would be allocated for treatment center operations, and a little over 2.5 million that would be allocated for night shelter and daytime engagement center operations. So that is kind of very quick overview. That is what was, this was what was presented in May as the starting point. So with that, I will stop sharing my screen as well and turn it back over to the next presenter.
Thank you, Mr. Buckenstad. So next we'll have the Health Policy Committee presentation. Also want to note for the record, we've been joined by Mr. Constant, and I don't know if anyone else has joined us that didn't get in the queue earlier. Go ahead, Health Policy.
I need permission to share my screen. Or perhaps it's not letting me. Susanna and I put together a spreadsheet.
You should be able to share. If you hover over the center of your screen, you should have that little taskbar come up.
Yeah, and it says we need permission to share your screen. Why don't I just email it to Felix really quickly and he could put it up.
And just in case this is an issue for other committees, which apologies, I guess we didn't realize this might be an issue. Feel free to email me the presentations, or Desiree, either of us. And I know Homelessness Committee, you already did that.
Well, and truthfully, we can't be sure this isn't my fault because I am not good at this stuff. So Steph's saying it's not my fault. Okay. So you'll all get this soon, but I'll go ahead and just start talking about it. Let me see. Okay. So Suzanne and I essentially took what the administration had put forward and then thought about it, and in light of what's going on generally in this
actually,
week.
apologies, Austin, I forgot to do something, and it's gonna you'll have a little bit more time so I can get the presentation up. Desiree, can we do a roll call? I forgot to do that.
We did a roll call, Mr. Chair.
Yeah, but it's all running together since we meet every hour.
Sorry about that. Okay, back to you, Ms. Quinn-Davidson.
Sure, thank you, Mr. Rivera. So anyway, I just wanted to acknowledge all the work, both with the assembly members, but also in the community. There's been a lot of work around this, and I'm just really grateful and hope that everyone feels included and that this is a process that allows everyone to weigh in. I think, Meg mentioned this in another meeting we had this morning, that there's a bit of a funding puzzle going on. So, there's a lot of interrelated services and pieces between the CARES Act, the alcohol tax, the MLMP sale, and what dividend might come off of that. Donations from our philanthropic partners. And I think that there needs to be sort of a more comprehensive discussion around all of those and how they fit together. So I'm glad we're going to be doing that. But in the meantime, Suzanne and I have put together what I think reflects sort of the direction we want to go, and perfect timing, Felix. After meeting with Health Policy, we didn't bring this to the committee because we haven't met since this was requested to bring forward, but I think it reflects a lot of the conversations that we had at the committee. And just keep in mind, it's a complete draft, and this is just for conversation purposes. So the first bucket, I wasn't super comfortable with calling that public safety because I think all of this is public safety. So Suzanne and I are now calling that first responders. And there's been a lot of discussions, Forrest mentioned this earlier in a meeting, around mental health first response and the real need for that three-part system, establishing a call-in center, transport, and then ultimately a facility. So I know there have been ongoing conversations. Meg and Forrest have been doing a lot of work on this, and also Bill Falsey. So I think that we need to be funding that through the alcohol tax. There's some question to me whether that overtakes the need to fund additional core team positions. So I think that there's some room for discussion there. Our committee's role was to focus really on the second bucket, and you'll see that we've proposed spending $1.5 million in evidence-based grants to providers. And then the bulk of it, 2.55, in early education. And Trevor Stores from the Alaska Children's Trust is going to talk a little bit after Suzanne and I are done, just about prevention and about early education and how important it is. From my perspective, it's the most effective investment in our future. And I guess I shouldn't say my perspective, because that's actually statistically true. And I think without doing this, we're just going to be constantly band-aiding the same symptoms unless we get to the root cause. And so I'm really, really hoping, I mean, we can't do things other cities and states are doing, right? Right now, to do universal pre-K would cost about $50 million a year. Obviously, we can't do that through the alcohol tax. But what I'm hoping to do is start and contribute a little more. And we're going to see, you know, the ASD is just cutting 1.4 million next year if we don't fund it. So we're actually moving in the wrong direction if we want to solve these long-term problems and actually save us money as a municipality. So the next category, you know, I'll defer to Meg and her committee and others with more expertise. But 3.5 million seemed reasonable based on some conversations I've had with her and others. It also aligns with the AO 2020-66 amendment that Suzanne and Meg and I have put forward. You know, in order for me to support that, I need to see a comprehensive financial plan and operational plan moving forward and how we would fund all of those pieces. So I think this reflects some of the conversations I've had with Jason, but I'm still waiting for additional information. And then lastly, we added in a piece, if you can scroll down just a bit, Felix, that's a communication piece. So I think part of the challenge we've seen in the alcohol tax, but in honestly everything else we do, is really working with the public and continuing to engage. Oh, and I neglected to mention that I had just added the library homelessness position also into the early ed. Meg reminded me of that, which was great. So I want to have some dedicated funding to communicating what we are accomplishing or still need to accomplish and what we're doing, no matter what, with the public. And I don't want it to be viewed as just another tax that they pay that they see nothing out of. And I recognize that there's going to be this larger balancing act of trying to show immediate progress to the public, but also make real, lasting, long-term generational change. And that's not going to happen by just band-aiding things. So we're going to have to find out how to balance that. And I think that's it. Suzanne might want to add a little something, and then Trevor's going to speak for a couple minutes.
Thanks, Austin. I really appreciate your hard work on this. I know you've been spending a lot of time in collaboration with me and others. So thanks so much for presenting. I think you hit all those points perfectly. And I would just add actually, to that.
Sorry, Ms. LaFrance, I just need to, Desiree, Mr. Perez-Verdia, sorry, my mouth isn't working today. Mr. Perez-Verdia needs to be let into the room, please. Thank you. Go ahead, Ms. LaFrance.
Thank you, Mr. Chair. I just would add that establishing stable funding for prevention and early intervention is critical, as Ms. Quinn Davidson mentioned. And I believe that we have Trevor Stores, is that right, Austin, queued up next for part of this?
Yes. And before Trevor starts, I wanted to remind everyone that the health department actually sent out sort of a white paper that recommended how to use the alcohol tax funds. So I might ask, I don't know if Natasha's on the line or someone else from the health department, and probably the clerk's office could track it down. But I think as we're having these conversations, it would be useful to have that as well as any other experts' papers like the theory of change or anything else that folks want to present. So if I could get that maybe sent around to members in the coming weeks, that would be great. And yeah, Suzanne, if you're done, Trevor, you're up.
Yes, thanks.
Hi, can you hear me?
Yes, we can hear you, Trevor. Ms. Quinn-Davidson, do you still need me to share this, or can I stop sharing?
If you prefer to stop sharing, go for it.
Okay, I'll go ahead, stop sharing, and then maybe Desiree can take that over.
Am I ready to go, Chair?
Yes, go ahead. Thank you.
Fabulous. Thank you, Assembly members, for this opportunity to just briefly talk about prevention. I do want to start off with just thank you all for the hard work around Proposition 13, not just getting it passed, but really trying to make it impactful for our community. The structure of Prop 13 was built with the prevention as a cornerstone. Prevention of child abuse and neglect, domestic violence, and sexual assault received the highest support in the polling of potential voters before the release of Prop 13. And I believe by including prevention language, it helped ensure the passing of Prop 13. We recognize every day our community is faced with issues, and our response normally is how do we address that immediate need? When we do this, we're looking solely at feeding the line and not exploring how to shorten that line. For example, a few years ago, Anchorage instituted a camp abatement process. Each year, that cost to clean up homeless camps has increased. And as we know today, that problem has only magnified. Addressing an immediate need, known as tertiary prevention, never gets us to the end of the line. And experience shows, just as I mentioned, the line only grows, creating more of a demand and higher costs. It is essential to go upstream. So when we look at these dollars, I encourage us all to be thinking in that mindset and using that lens. By going upstream, we're able to address the root causes by utilizing what we call primary prevention services, resulting in the line being shortened and cost savings. So for example, in the world of early childhood, James Heckman, a Nobel laureate economist, has shown that for every dollar we invest in early childhood, so this is from 0 to 5, we save taxpayers up to $7 long term. And this methodology is not new to you. The investments made to our port, for example, is to prepare to handle an increase in demand in years to come and ensure structural stability. You're not waiting till it falls apart to invest, which would result in higher costs. Another example was back in November of 2018, it was our building codes that ensured our buildings survived a 7.1 earthquake. We were prepared because we took preventative steps. The funding in this category is primary prevention. To achieve the intent of Prop 13 and the desires of the voters, we need to, at a minimum, equally fund these. Think of prevention, primary prevention services, as a true investment in our future. Please ensure we invest in primary prevention for the long term and not just look at the short term. Thank you, and I'm open to questions if necessary.
Thank you. Ms. Quinn-Davidson, was there anyone else in your portion of the meeting?
That's it. Thank you, Mr. Chair.
Great. Thank you. And yeah, like I stated earlier, we're going to get through the presentations and then do questions after. So I guess Assembly members, write down your questions so you don't forget. So next, I'm going to turn it over to the Assembly Committee on Homelessness.
Great. Thank you, Felix. This is Meg Zalatel. I was able to share my screen. That is one of the things I've learned during the time of COVID. So what we did is we, as you might remember, engaged in a process of discussing the alcohol tax funds around the pillars in Anchored Home. And then we took that information and we really went back, excuse me, and took a look at it after we received the gap analysis from the Coalition to End Homelessness. I feel like those two the Anchored Home is really a foundational document. It's our priorities. The Assembly priorities are reflected based on what's set in Anchored Home. But then the gap analysis really gave us an implementation paradigm to work from where we could put funds to the highest and best use around homelessness. And of course, the bucket, so to speak, is homelessness, mental health, and substance misuse. So we have here, and this sheet is a little bit more refined than the one emailed out earlier, just so it's easier to read. The category, the project description. So our first item is the overnight shelter for 150 individuals. And I've identified what I believe to be the municipal department and how it may work. And I'll get to that at the end and why I did that. That's $360,000, taking into account the $735,000 we already have in the general operating budget, and that it would be ongoing. Next would be day engagement or day shelter. Again, looking at the health department would likely administer that, and $1 million ongoing. And that, you know, we've heard that philanthropy might be helping us out in that area. So it's just something I want to flag. It's nothing's definite, but I think it's worthwhile to flag that that might be the case. As you all may remember from the committee meeting, the library social worker support, it was just under $215,000. So I just rounded it up to a round number for these purposes, and that would be ongoing. And we've shown considerable assistance and contacts, and it really would mesh well, as we heard during the presentation, with getting folks connected with day engagement, day shelter, or possibly preventing homelessness, because there are folks who are not yet experiencing homelessness that are really taking advantage of that program. As I think a lot of folks have mentioned, and I've changed this bucket, public safety, and then taking Austin and Suzanne's lead, first responders, because that's really what we're talking about. Mental health first responders, $2.5 million, which would be something along like the Cahoots model, or maybe an expansion of Anchorage Safety Patrol, but all fits within the state's mental health redesign around Crisis Now. This would really be the, I hate this phrase, but it's the best one, the boots on the ground approach to get a social worker, trained driver out there helping defray the calls from APD, giving the more appropriate response. And I have over on the sheet there, presumes a CARES Act startup funds. It takes some money to seed that infrastructure. There also is potential to expand that work later, to possibly help bring on a crisis recovery center for 23-hour stabilization, and that would be MLMP funds, but then the ongoing operating may play in here. Year-round camp abatement, this is something Mr. Constant and I are really quite passionate about. If we are going to bring online shelter and we have year-round shelter available, let's not let camps persist. I don't have the gap in funding. I have what we have in our general operating budget, and the hope is it would scale back as shelter services come online, but that would be a little bit of a dance to figure out where the sweet spot is moving forward. I didn't want to just look at homelessness though as responding to homelessness. I wanted to look at what housing supports, and so did Mr. Constant. And so we have $1 million ongoing, and this is really broken into two pieces. Permanent supportive housing, there's a gap for providers to bring online permanent supportive housing at about $350,000. And we've been advised that bringing one provider on every year or 2 years is really what's realistic due to workforce capacity issues. But we would also have the opportunity to expand rapid rehousing by investing in risk pool insurance for landlords. And I've had a really great set of conversations with Cook Inlet Housing about how we could help scale what they've piloted to really keep people out of homelessness or get them back into housing as fast as possible. As folks probably also know, outreach has been a high priority. So this would take the $432,000 figure was taking what we appropriated at $180,000, just breaking that up month over month, and then taking that monthly amount as a yearly amount. And then I added it in here because the bucket includes substance misuse. So it's got the $2 million the administration has said for treatment center startup, time limited, maybe 2 years. I don't know if philanthropy would be involved. But what I think is important here, and I would love to hear the health department later chime in is that a lot of this is health department administered. So I put in what I think would be 2 to 3 positions worth of people for the health department, and then totaled it. And I don't know if Mr. Constant has anything to add.
Mr. Chair.
Go ahead.
Yes, I do. You know, as you can see, between this and the previous spreadsheet, we've spent in excess of what we have as revenue from the alcohol tax. And I may be a minority report on all of this, but I didn't hear anything over the course of the last 2 weeks of debate that swayed me to think, oh, this might be a bad idea, what we're looking at, until I saw the framework that was sent to us this morning and realized that we could be spending 2/3 to 3/4 of our funds on prevention when we have just created, if we do, 4 new major programs that need to be stood up. And so my biggest concern with all of these proposals is that we have before us a substantial project that we're about to implement should the votes go a certain way, and we may, from its beginning, starve it. And I believe that we would be wise to consider flipping the table to a 2/3, 1/3 model of homeless interventions, priority 2/3, prevention interventions, priority 1/3 for the first 3 years, and then slide it over and flip it at year 3 or 4 to where we move more holistically into the prevention schedule. I'm concerned that we are going to do what the worst fears of the public that I heard were. And so while I'm supportive of the model that was presented here by the committee chair and I helped to develop, I think we need to be really wise. And I think Ms. Davidson made an important point that we need to see an overall plan for those other projects in order for us to understand and say yes. And this is, to me, one of the key links in that being successful. And so that's just a fairly minority report to the body's chair. I'm supportive of it as a proposal, but we have a tough conversation here.
Thank you, Mr. Constant. Anything else from either of you on the Homelessness Committee presentation?
No, I didn't point out, though, that there are some overlaps between the proposals. I'm sure people are catching that we looked at it because these buckets or these areas do overlap. So if you're kind of keeping tally for some reason, that's something to be mindful of. Thank you, Mr. Chair.
Thank you, Ms. Alatel. Okay, so with that, I am going to go ahead and move on to the Public Safety Committee.
Well, thank you, Mr. Chair. I'll chime in here. I'm not sure if Mr. Perez-Verdia has something or not. You know, I've been out of town with my mother's death for, I don't know, till Tuesday. And so I am really behind, but I was just going to say, I certainly can tell you what I know unless Mr. Perez-Verdia has something more formal, but I'm happy to share, you know, what we've gone over in the Public Safety Committee. So, and I don't know
Sure.
if camera's on or not.
I think he is. I think he's one of the phone numbers. But okay. Go ahead. You can start, Ms. Kennedy, and then I'll go to Mr. Perez-Verdia after.
All righty, thanks. I don't know if you want me to share my screen on some of these reports or updates that we've gotten, but I guess I just want to say that for the most part, a lot of what the Public Safety Committee did was actually represented in the same comments that Jason Bockenstead actually gave at the start. I noticed the numbers were a little bit different than what we had gotten. But we really looked at, we had a presentation from APD and from AFD and from the Department of Law. And I will say that the Department of Law had a similar request. We had a presentation that said they were looking for 500,000. And I'm going to pull that up, and I don't know if you want me to share my screen on any of what I have here, just in terms of the documents.
Feel free to.
Anyway, okay. Let me see here. I'll find the button. So, all righty. Okay, I'm not finding the share my screen button. I probably have to have video on first, right? All right, let me see what else we can come up with here.
It's in the middle, Crystal, if you hover over the middle where you mute and unmute, that little box with the arrow.
Yeah, but I don't have anything that says share my screen.
Crystal, are you using your iPad?
Yes, I am.
That might be the issue. If you could just forward it to me and I'll screen share for you. This
Great,
does.
thank you. Okay, thanks, Desiree. All right, let me go back to the documents. And get this sent off to, okay. All right, okay. I don't know that I can send this to you, Desiree. I'm not even finding the button that tells me to share it. Let me see, here we go. Yeah, let me try that. Okay. All right, that is on its way to you, Desiree. But basically, this is the Department of Law where they asked for an additional attorney and an additional secretary. And they also had some technology upgrades that they were requesting. And the amount that came up to was $350,000. So that was a little bit less than what Jason had. So I'm not exactly sure what the difference is, but this was the presentation that we got from the Department of Law. And it could be that those are benefit costs or, some kind of, additional administrative cost with adding on those additional employees. Okay, then if we look at what the APD had, they had a much more, definitely a bigger, oh, no, I can't find that one either. They had a larger amount as well. They had over $3 million. And let me see if I can find that one and send it to you too, Desiree.
Crystal, the document you just emailed over to me doesn't actually open.
Because it's an iPad, right? Oh, well, and now I'm having trouble getting back on my other screen. Doesn't want me to. Let's see. All right. I'm back. Yeah, I'm just having way too much trouble with this. So this probably won't help me to send this to you either. So, okay, and now I can't even open. Yeah. I'm sorry, you guys. This is not working for me today. So, but anyway, I know APD had a much more robust request. Their funding came up to about 3.4 million. It included a lot of, it included the idea of having more patrol officers on trails. It had more funding for camp abatement. And then without seeing the document, I really can't find more of those details for you on that. Yeah, it won't even light up for me to be able to open up. So that's my problem here. So let me go on then to the Anchorage Fire Department. That one pretty much mirrors the idea of just expanding the core team so that there was a couple of more teams that can actually be used for any of the community response capability. And I think Meg kind of touched on some of that anyway with her presentation on the homelessness funding. So the amount that it comes out to, though, is well over 5 million. But I'm going to have to leave it at that, Mr. Chair, and I apologize. I can't believe I'm having all this technical difficulty. It worked for me when I was getting this all ready, but anyway.
Thank you, Ms. Kennedy. If we can at least forward those documents to the clerk and then have the clerk send them to the body, that'd be great so that we can review them. And yeah, happy Friday, everyone. Mr.
Yeah,
Perez
I can
Verdia.
do that. I
Great,
can
that's great.
forward those. So.
Appreciate that, Ms. Kennedy. Did you want to add anything, Mr. Perez Verdia? And you're muted right now. I believe you're one of the phone numbers. I believe it's *6 to unmute yourself if you're on the phone. Okay, maybe we will come back to him later. Okay, so next we're going to turn it over to Recover Alaska and the coalition that has also, in tandem with our process, has been working on their own recommendations to the Assembly. So I'll turn it over to Tiffany Hall.
Thanks very much. Can y'all hear me?
Yes, we can.
Super. Thank you so much. I'm Tiffany Hall. I'm the Executive Director at Recover Alaska. And for the purposes of this presentation, when I say we, I will be referring to a collaboration between Recover, the Alaska Children's Trust, Homelessness Leadership Council, Alaska Black Caucus, and Agnew Beck, with input over the past 6 weeks from hundreds of people, individuals, and those representing dozens of organizations. I emailed you all a few documents this morning, our theory of change and logic model that we've talked through before with you, the full list of project ideas that have been shared with us, and a document called the Funding Framework, which outlines our recommendations for both where and how to allocate the tax revenue. And that's where I'll spend my time today. We know that upstream prevention works and has a strong return on investment, but we also know that we have people and communities in crisis today. So we started with a simple principle. For every dollar we invest in addressing today's crises, we commit a matching dollar in long-term prevention. I'll explain how that's noted on the chart in just a moment. But first, I want to highlight something that has come up at every single meeting we've had, and that is critical to address in order to be successful in any of the areas outlined in the alcohol tax ordinance, which is the need for systemic racism to be addressed by this funding and an equity lens to be applied to all funding decisions. This is necessary to make any meaningful progress toward the issues we've talked about solving for decades. If you look at any issue listed in our table below, and thanks so much for pulling that up, if you want to just scroll down to the chart. Oh, sorry, it's actually, it's the one titled Anchorage Theory of Change Funding Framework. Thanks so much. So if you look at any issue listed in the table or any issue in public health, education, economic development, criminal justice, civic engagement, racial disparities across the board are a primary cause. This is not a coincidence and it is not disputable. Our systems are geared in subtle and unsubtle ways to prioritize some people over others. And if we continue overlooking this and not specifically focusing on undoing it, nothing will change. I think the past 2 weeks of testimony and the disparate impacts of COVID-19 on our residents and across the country should be more than enough to convince you that racist ideologies and systems are alive and well here in Anchorage and throughout our nation. This is your opportunity, and I dare say your obligation, to take action in a new way and make a positive difference in our community. And I know you recently passed a resolution addressing equity, which I commend you for and thank you for, and this would be a perfect way to tie into that work. So that said, I'd like to quickly walk through the chart on the funding framework. We divided it up to show categories or types of projects in the far left column, with headers in the blue bars, and apologies, we accidentally called two of them healthy families. The second one down should be homelessness and treatment. And those describe what the categories are addressing. The next two columns marked now and future describe whether the work is dealing with current critical needs to help people today, or if they're more upstream and root causes, and that's marked future. The next column is the amount of funding we believe should go toward this type of work, followed by which bucket of funding the work addresses in the tax ordinance. So 1 being public safety, 2 is prevention of sexual assault, domestic violence, and child abuse, and 3 is prevention and treatment for substance use disorders, mental health, and homelessness. The final column on the right explains a bit more about the category from the first column, with occasional examples to help describe what we're talking about. And that's as an example, not necessarily to promote those as best solutions. Pages 3 through 7 of the funding framework document lists many of the specific projects shared by the people who engaged in this process and which category they best fit into under the categories in this chart. So to walk through, we believe the funding should go to these types of projects. First, dismantle systemic racism and support systems change. Under bucket 1, we believe it should go to a citizen review panel, restorative justice initiatives, and the continuum of services for behavioral health crises. And this is what we commonly think of as the crisis now model, but framed this way to recognize that there are a couple of different models out there. Bucket 2, we believe it should go to domestic violence, sexual assault, child abuse crisis response programs, many of which are listed in the other documents, and promote healthy babies and families in first years of life. And then bucket 3 would be the shelter operations funding, treatment operations funding, housing innovation fund, and a treatment recovery and prevention innovation fund. And there are dollar amounts listed with all of those. I know that you asked this group to provide specific examples, and we have collected over 80 programs, examples from other communities, and ideas to share with you. But for us to choose a few winners would not follow the collective process and spirit of this larger group we've been convening. And it misses the opportunity to be thoughtful and intentional about what will have the most impact and for whom. Not only would we miss the chance for innovation, but more importantly, it would perpetuate the very systems we believe need to be dismantled. And that brings me to the second page of the document. Throughout our process, we heard 2 key themes again and again. Racial equity needs to be both an activity and a paradigm shift, and nothing about us without us. Individuals with lived experience of homelessness, racism and discrimination, substance misuse, adverse childhood experiences, and interpersonal violence were welcomed to this process as subject matter experts, and this product is infinitely better as a result. While these perspectives need to be prioritized in all areas of government, this is especially true in decisions about how public money is spent. In addition to our recommendations for what to fund, we strongly urge you to fundamentally change how we decide which will impact whose priorities are represented and who receives those funds. So our specific recommendations in that area is that the Assembly should identify general intent and desired outcomes for the proposed funding streams, including any allocated directly to the municipality or to the Anchorage School District, and then delegate the decision-making to subject matter experts to include individuals with lived experience. I know this may feel like exactly what you are doing right now, and what we mean by this is don't rush to personally decide specific organizations that should receive these dollars where they're spent outside of direct municipal or ASD allocations. It's clear that you've been working hard on this and listening to experts, but it's been a time-limited process. And as you can see from our full list of projects, there are dozens of great ideas out there, and our list is still not exhaustive. Rather, let specific projects be chosen through RFPs or other allowable processes, and consider alternative stewards for allocating the funds whose grant-making processes are centered around equity and community impact. If provided clear guidelines, intended outcomes, and demonstrated understanding of their responsibility for allocating public funds, non-government funders could provide more flexible, community-centered, and culturally appropriate ways to prioritize projects. We've been doing research and are happy to share it with you in addition to the criteria we have listed in this document. Finally, we recommend forming an oversight body to monitor implementation, from reviewing data and reporting to evaluating potential future uses of the funds to providing an oversight role to keep recipients of the funds accountable for results. And we highlight funding for this in the last line of our chart. Thanks very much for your consideration, and we'll be on the line.
Great. Thank you so much, Ms. Hall. I'm I think with that, that takes us through all of our presentations. So I'm going to go ahead, turn it over to discussion for the remainder of the time. Before I do that, just as an FYI, with the transition of the meetings from in-person to virtual, we lost 10 minutes. But if we're okay sort of going really back to back, I'm okay with us extending this meeting a few minutes if we need to. With that, I have Ms. Quinn Davidson.
Oh, thanks, Mr. Rivera. I was going to ask Ms. Hall about the Citizens Review Panel. It seems like there are a lot of, maybe I'm wrong, but other efforts going on. I don't understand how that's different from the Special Prosecutions Office. Is that only when there's a police shooting? So I'm just trying to understand how to put that in the context of the other conversations we've been having.
Through the chair, thanks very much for the question. So I will say that this idea was brought up sort of in a vacuum of talking about alcohol tax revenue without having all the information about everything else that the municipality is doing. This was brought up as an idea for like a citizens review panel for independent oversight and investigation of police-involved incidents. And we did have conversation about thinking maybe at one point this existed and doesn't exist now, or maybe it's being kind of reignited right now, but we just think that it's critical to include that piece. I don't know if that answered your question or not.
Yeah, I think it's okay to keep talking about that alongside developing other things and just see where we land. But eventually, it'd be good to know what are all the bodies or not doing that work, and how do we make it most effective. May I ask one more question, Mr. Rivera?
Go ahead.
I just wanted to ask Mr. Buckenstead. So I've been asking for, I think it's weeks, but it could be longer, for a financial operating plan moving forward for the proposal for AO 2020-66. And I know the public wants to see that too. I think it's really intertwined with the proposals we're looking at today and what we end up doing with the alcohol tax. So I just want to ask him if he's planning to produce that before Monday.
I think we will, through the chair, Assemblymember Quinn Davidson, I think we will certainly have a larger conversation between now and Monday about what some of those numbers look like. But I think, as I explained on Wednesday night, and will again on Monday, I think part of the final budget that we can actually hang our hat on for operating each of these facilities will come during the RFP process, when we ask for all of the providers to submit proposals on how they would operate these facilities. So we can certainly discuss what we think these numbers will look like based on how some other facilities have operated and what we know some of these other facilities cost to operate. But the actual detailed numbers will not come before Monday, but will come during the official RFP process.
Okay, I'll wrap this up, but I'd like to see a document, even if it's an estimate, by Monday. Thanks.
Thank you. And Ms. Hall, you had a quick follow-up?
Yes, thanks. Sorry about that. Just to say, I hear you, and thanks for bringing it up, and we'd love to know what else is going on about these. One thing that we highlighted in our conversation is that the citizen review panel it's key that it's independent and citizen-led, and we have done research on a lot of other communities throughout the country to see what their budgets are and how they've been running it. And if further conversation here happens, we'd love to share that information with you all.
Thank you. Mr. Whittleton.
Thanks. I have I guess a couple, if that's all right. One for Tiffany. How did you develop these dollar amounts?
Through the chair, thanks for the question, John. When people were bringing projects up on our calls, some of them brought very specific dollar amounts, some of them brought estimates for us, and we sort of extrapolated on those what we think it would cost to make a meaningful impact in that area, as well as keeping an eye on our theory of trying to fund both kind of tertiary or immediate prevention as well as upstream prevention.
Okay, so Felix, can I carry on a bit?
Go ahead.
Okay. So would this be, I just look, say, shelter operations funding, $2 million. Would you expect that's $2 million from the alcohol tax, but there would also be money coming from other sources? Or is that like, that's what you expect it would cost for a shelter that would have 100 people or something?
Through the chair, thanks. I
don't know is a fair answer, I suppose.
Yeah, no, I think that we were thinking that this would be part of the funding, not necessarily enough to cover complete operations for a shelter. And again, a lot of these conversations were being held without full kind of understanding of what was happening with the building purchases. And so we were just talking about where we think alcohol tax funding should be spent, knowing that other pieces are in play, the CARES Act funding, as well as private philanthropy and then the MLMP sales, but without having full knowledge of all of that, we were just thinking, we think at least $2 million of the tax revenue should go towards shelter, whether or not it stands alone.
Yeah, okay, well, that's good. So I just have a couple points, and I think one is similar to, oh, and Tiffany, thanks for this. I'm moving on a bit. Like Chris had said, you know, we don't really know what to do here until we see what happens with 2020-66. And, you know, as I've thought about this, you know, we don't even know how much alcohol tax we'll get. I know there were estimates 8 to 14 million or something like that, but we live in a whole different world now. And this kicks in February next year. And if people change their habits or still not going to bars, it could be far less than that. And any year it could go up and down. We just don't know. But to budget ahead on something that has absolute uncertainty is very risky. And I know this will drive everybody in the room crazy, but we should consider kind of forward funding thing is like, let's find out what we raised in 2021 and we'll put it in the budget for 2022. Otherwise, you're going to leave people hanging. They'll have, you know, start a treatment operation, and then we just didn't get the money. Sorry about that. $250,000 is not going to cut it, you know. So there's so many unknowns. And if we look to the long run for this, you know, we missed 1 year, but you know, 10, 15 years down the road, we'll have something steady state. And also, as you look at these, you know, I really appreciated that conversation with the tribes the other day. I mean, that stuff is so new to me. But in a follow-up email, they kind of mentioned some things. Here's what we could bring to the table. And I don't see the tribes mentioned here, which, you know, maybe it's early for that, but you know, I think we need to make sure we make room for that and not say, we invited you to the table, but, oh, we spent more than we were going to raise anyway. So thanks anyway. So anyway, that's just a few comments. Thanks.
Thank you. And I'm next in the queue. So a few things. So first is, yeah, I actually, Mr. Weddleton stole my thunder a little bit. I wanted to raise and uplift two of the ideas which were brought up in the second meeting with the tribes, which, you know, I apologize for everyone else who wasn't able to attend. I know there's a lot going on. But hopefully everyone had a chance to read the notes that were taken. And in it, there were two ideas that I want to uplift. So first is the idea of long-term planning for the funds, which I think might be able to get a little bit to this idea of what if we get drastically less in alcohol tax funds than we expect. This type of planning might be able to assist with that. want to acknowledge that that planning was included in Ms. Hall's presentation. I did see that in there. I think it was 250,000 was the recommendation. Then the second idea that I want to uplift from the conversation that was had with the tribes was this idea of office space, which seems weird when you compare it to a lot of the other ideas that have been brought forward. But the way that the tribes framed it was, we need space for us to work with our tribal members who reside in the municipality of Anchorage to work on these issues of domestic violence, sexual assault, to work on public safety issues, to work on issues of treatment. And there was I think a lot from the conversation that I had with the tribes, and I think it's reflected in the notes. There was a lot of positive that the tribes felt could be used with just the simple idea of give us some space to work with our tribal members, and we will accomplish the goals that are set out in the alcohol tax. Third of four things, sorry, is I wanted to give, after I'm done with the fourth item, Dr. Monsager, if he has a few minutes to talk about the recommendations that we got from the Homelessness Leadership Council. I know we got that email with those recommendations, so I don't know if Dr. Monsager, you want to add to the conversation. Fourth thing before I turn it to Dr. Monsager is just want to get a sense from the members about how all of this is going to be translated during the alcohol tax town halls that we have coming up very soon. So those are the things I wanted to bring up, and turn it over to Dr. Monsager if you wanted to add something quickly.
Thank you, Mr. Rivera. The only comments I would make about the recommendations you received from the Homelessness Leadership Council, and I sent it to members of the Committee on Homelessness and to you. I did not send it to the whole committee, or whole assembly, so I apologize for that. But I think that so far the recommendations that have been made, the Homelessness Leadership Council endorsed the idea of enlarging mental health workforce rather than increasing sworn officers, and I've heard that already today in one or two other places. That in answer to Mr. Weddleton's question, I think the HLC was also thinking that $2 million should be invested into shelter operations, but this is not the entire budget for distributed shelters. It'll be a mixture of funding sources. That $1 million should be invested into substance abuse treatment. At the time we put it together, it wasn't clear there might be a new residential treatment center soon, but if there is, that's where the money should go in the opinion. There should be year-round camp abatement and, importantly, camp outreach, but only if there's adequate shelter year-round. And with that, I think, one other thing that I would endorse Ms. Zalatel's comment about the idea of stimulating more permanent supportive housing by doing some what I'll call gap funding in the same similar dollar amounts that the Committee on Homelessness put forward was also a principle that was endorsed. The principles that were endorsed were really around trying to support people in moving on with their life. And with that, I'll be quiet.
Thank you, Dr. Monsager. With that, I have Mr. Constant.
Thank you. A few things. I agree with John's framing that for a number of these priorities, it might be wise to wait one fiscal cycle, except for the issue of homelessness, mental health, and behavioral health in relationship to the passage of AO 2022-66. And so I'm going to be really laser-like focused on that. Dick, Jason just suggested that he will be working on a rough draft of some kind of a fiscal framework around how those facilities may get implemented. But if we don't have a balance sheet that works, then how can we move forward? And so I am hopeful that you can work with Jason over the weekend in discussions about what the homeless leadership group is willing to put on the table, at least in a rough, so that we can see that the sheet balances. Because if we don't have a balance sheet that works, at least in a draft format, then all of these conversations, 15, 20, 30 hours of hearing all of that might be for naught. And I have a question for Tiffany as well. So I'll lay them both on the table, then Dick and Tiffany. Tiffany, you said something that wasn't specific, and I'm going to ask for a little more specific information. You suggested that you believe that authority to grant these funds should be given to parties other than us. And so would you be more specific who you think those people are? So it's 2 questions. Thank you.
Mr.
Through the chair,
Rivera,
thanks very much. Oh, go ahead, Dick.
Maybe I'll answer the first question. Is Rasmussen Foundation, we've been in conversations with Jason and with Nicole Lebo in the health department, and Rasmussen Foundation is committed to investing up to $3.5 million in the first couple 3 years to support operations of engagement centers. And we intend to work in partnership with the municipality as the municipality uses funds from the ESG funds from the Federal CARES Act, the alcohol tax, and other funding sources in a way that is complementary and contributes to a balance sheet that funds the operations in the early years.
And so we need to see that though, Dick, like Monday, something, not a commitment. I understand everyone has their process, but I think Ms. Quinn Davidson asked for it, and I'm right there. We're hoping to see something that shows a baseline in writing that we can hold on to begin that conversation before the vote on Monday. And so also there was a question from member Quinn Davidson that is, was that 3.5 million a year or total over 3 years? So like, 1.25
in total.
Okay. So yeah, the hope there is something working with the administration that everyone can get on page, because we need that. Tiffany?
Thanks very much. We had a big conversation about how the funding should be given out. And our first thoughts were, give this to granting agencies that already are in the practice of putting out, requests for LOIs and RFPs and making decisions on funding. And then we realized that many of those don't have an equity focus and are buy-in for Black, Indigenous, people of color. But we still think that it might be a good option to go with them if we can also help them create some guidelines and criteria about how to center this work around those marginalized voices. And so some examples of people who do this, we thought of First Alaskans Institute, the Community Foundation, the Children's Trust, the Mental Health Trust. And we would what we were talking about is potentially giving them funds to distribute, but helping to include criteria saying, here are the goals we want this funding to achieve, and here's a criteria that must be included in grants. What neighborhood, population, community, or mission does the organization serve? What % of the board or leadership is composed of BIPOC? Does the project operationalize equity? And maybe this is, again, my ignorance, I guess, of how all of the different systems work within the municipality. It could be that those can be given out through the health department. I'm not sure how robust the granting process is there, but it feels like it might, well, I guess I'm not sure because I don't know enough about it. I'm not going to say that these other granting mechanisms are better, but we think they should be considered.
Thank you.
Thank you. Ms. Zalatel?
Thank you, Mr. Chair. I think we need to make sure we're bringing forward the consideration. I'm just going to kind of raise this to the level again of what it's going to cost to administer this work we want to do and build that in. I have to say also Mr. Weddleton's idea about a pause, and I'm not usually one for a pause. I want us to have a space, I guess, at some point to discuss that more in depth with, Treasury and everyone else in the room. And then I also want to make sure that we touch on before the end today, if we can, what kind of process we'll have moving forward in terms of, we kind of have four proposals in some regards, and to where do we go with these into the next phase? I know we have the town halls coming up, so I definitely would like us all to touch on that so that we all are on the same page, and it can help guide the work we're going to do moving forward. Thank you.
Thank you. Mr. Peterson? Mr. Peterson, we can't hear you.
Can you hear me now?
Yes, we can.
Great. Thank you, Mr. Chair. I was wondering if we are planning to have some sort of wellness court, or once we, because once we get some more treatment facilities available, we would need some sort of administrative judge or something to maybe try to get more people in to sign up for treatment. Just wondering if that's, anyone has thought about that in planning for the future. Thank you.
Thank you. I assume it's just an open question to anyone who can answer. So if there's anyone who wants to answer that, feel free to.
Mr. Chair, this is Ms. Zalatel. Can I ask Mr. Peterson a clarifying question?
Go ahead.
Sure. Pete, are you meaning in addition to the wellness courts that exist already in the court system, like the Veterans Court and the Mental Health Court? Are you imagining an addition to that?
I didn't spend a career in the legal field, so I'm not 100% sure what's already available out there. I didn't see anything on the list for funding for something like this. So if it already exists, then we don't need to recreate the wheel or whatever. But we did hear a significant testimony this week from people about, I think it was at the Rhode Island model they were talking about, where people had a choice to be incarcerated or get treatment or whatever. I'm not sure if that's an area that we're interested in or not, but I just thought I'd ask that question.
Thanks. So I have Ms. Salta. I don't know if you want to answer, but I think Mr. Constant's in the queue to respond as well.
No, that's good. I just wanted some clarification. Thank you.
Thanks. Mr. Constant?
Yeah, the state wellness courts are very narrowly prescribed, and I think the suggestion you just made, Pete, is very interesting, especially in the context of the fact that much of the anger that we heard related to the failure to have what some might euphemistically call Intervention 2020 was the failure to address criminal activity in any way that are these low-grade, ongoing, critical issues, not related to things like us failing to put toilets out there, but theft and other things like that. And so it's a very interesting concept to put together, like a misdemeanant local version of this that could work with our prosecutors and that could work with the police to come up with interventions that are humane and reasonable. Could also be tribal oriented, but it's certainly not something that was on the list and would beg a deep, thoughtful investigation.
Thank you. Moving on then to Mr. Dunbar.
Yeah, there's a lot there. The question of wellness courts, which I don't think I'll have time to go into. We don't have time to go into. I mean, simply put, though, the city doesn't really run courts. The state does, and that would require a tremendous amount of collaboration with them. And I'm not sure if the Rhode Island model actually exists. I was trying to research that when he was talking about it. It seems largely a creation of that movie, Seattle is Dying, which has been largely debunked in the Seattle press. But anyway, moving on from that, we have a number of proposals here, all of which spend all of the money and more, right? And so I think at first blush, it can be a little discouraging looking at them all and thinking, this is now impossible, or one side has to win completely. But I think that first of all, we always have to keep in mind the will of the voters in April and the strictures that they placed around the funding. And once we do that, I think that I do think that there is a way to satisfy a lot of these different groups. I think it's going to take work, but I think this can be synthesized into a version that can make really transformative change. Although I will say, going back to what Chris and John were saying, if AO 2020-66 is creating a situation where it has to, by necessity of us passing it, consume a majority of the alcohol tax revenue, then I don't think it's an argument for pausing the discussion of the alcohol tax revenue. I think it's an argument for not passing AO 2020-66 or delaying it by quite some time. And I know the administration doesn't want to do that because they, especially for some of the housing facilities, there's a real pressing COVID-driven CARES Act-related need. But in a similar vein, for example, if I was to list all the different things we're working on here, the thing that really sticks out to me, and I've brought it up a number of times, and a number of us are working on it, is the crisis now, or whatever you want to call it, the CAHOOTS model, the different ways to respond to mental health and to move us away from a traditional view of policing that this summer has also been surfaced as having some real inherent flaws when it comes to effectiveness and equity. And so if you were to tell me, if you vote for AO 66, it means that a mental health corps cannot exist, then I am not going to vote for AO 66. But I don't think that's what's going to happen here. I really hope that isn't. Now, in terms of my question, I also had a question, though. I know we have on the line Celeste from the Alaska Black Caucus, and I was wondering if she could speak a little more directly to equity issues. Can I ask her, Mr. Chair?
Sure. Absolutely.
Celeste, are you still on the line? I think she is. Maybe she's on mute.
If Celeste is on a phone number, it's *6 to unmute yourself.
Hi there. Good afternoon. Can
Hey,
you hear me?
Yes,
Yes,
we
we can.
Hi.
Thank you.
Go ahead.
Okay, so as the president and CEO of the Alaska Black Caucus, which for those that don't know, it's a nonprofit organization that champions the lives of Black people, and as former president of the NAACP for nearly a decade, and for those that don't know, it's the largest and oldest civil rights organization in the world, and as the former director of the Office of Equal Opportunity for nearly 6 years, I come from a background of civil rights, equality, and equity. I live and breathe it. Racial equity and systems change are not an activity, but a paradigm shift. You must make a conscious effort to seek out equity through a lens you might not have used before or often. As you allocate these funds throughout the process, please make sure to utilize your equity lens. As shared, many organizations, especially diverse organizations, think the ways funds are allocated today through competitive RFP processes or sole source procurements gives advantage to those who have the most experience, expertise, and prior success in securing funding, not necessarily the most impactful, promising, or community-based ideas. Now, I'm not trying to say anything negative about any other group that has put forward a funding request, because I support them. I mean, I was a part of the process, but I just ask that you just take a look to make sure that there aren't groups that are disproportionately recognized. Equity requires we look deeply at systemic programs, practices, and policies to identify injustices and remove barriers that benefit one group over another. I mean, I thank Tiffany for what she shared. And let me just say, I'm so thankful to be a part of this process with Theory of Change. First of all, we welcomed everybody. And then we invited everybody that was at the table to invite people. So it was very inclusive, something I have never experienced with the city. And with this process was great. And so finally, just having an opportunity to have a seat at this type of a table is something, like I said, I've never been a part of, and I'm so appreciative. But we do have to do things a little differently. Why is it that Black and other organizations of color repeatedly are turned down when we apply for grants? So it's got to be something, and I just ask that you take a look at that. Thank you very much, Forrest, for the question.
Thank you, Ms. Hodge-Grouden. Thank you, Mr. Chair.
Thank you both. Okay, so just going back through, I think I'm next in the queue. So a couple of things. So first, again, I'm keeping my eye on the town halls that we have coming up. It sounds like there is some alignment in a variety of the plans, and then not in the plans. So what I would like, if it's possible, where there is alignment, if we can consolidate those, and then it just sounds like we have potentially 4 different presentations, just like we did today, at the various town halls, but I might be wrong on that, and would enjoy guidance from any other members who have thoughts. Also, sorry, recognizing that we are very limited on time as well. When I get to a question that Ms. Zolotel raised about process, so just based on the resolution that you authored, Ms. Zolotel, and then conversations that we had in May when we started this process, this is a draft of a slideshow for the alcohol tax town halls. And so this is going to be at the very end of the town halls, and I'll just read it for folks on the phone. So it's process from here. First is meeting, a follow-up meeting with the tribes, which is tentatively planned for late August. Next is work session, and then I should probably just get rid of the parentheses S and just plan for multiple work sessions to process the town halls and then finalize a plan. I'm going to just pretty obvious, just based on everything that's stated here, that may not be feasible, but would love feedback at some point. For early September, then resolution stating intent of use of alcohol tax funds with public hearing at a regular assembly meeting in late September. Then, of course, the vote on the 2021 budget in November is our final decision point, although recognizing that we have the ability to change the budget throughout the year as we see fit. So that's was my initial take on the process from here. So just stopping sharing my screen. So I'm going to ask the members for a motion to extend by, I don't know, 8 minutes. I want to save at least a couple of minutes between this meeting and the next one. So can I get a motion to do that?
Move to it.
So moved, Zalatel.
Okay, moved and seconded, Zalatel Constant. Is there any opposition? Okay, hearing none, then we'll go to 2:38, and then we have to transition to our 2:40 meeting. So Mr. Constant.
Thank you. Just to the point that Mr. Dunbar made about concerns related to should we go forward with that other project if we don't have a good sense. I tend to agree with that as a principle, but not as you kind of came to your outcome. What I started this conversation with is that it would be wise for us to contemplate ramping up substantial funding in a term-limited basis for that project, and then predispose and pre-prepare a transformation of the funds toward the more preventive based. Although I would argue that the police, mental health, first aid, whatever that program ends up becoming, is actually a direct related expense to this effort, because it is ultimately many of the same people. And so I just think that there are other projects that we could ramp up later. And so again, we can have that debate in a bit, but I think you make a valid point, and it doesn't have to be all or none. It can be, let's do part now and move it to another framework shortly. Thank you.
Thank you. Mr. Dunbar?
Thank you, Mr. Chair. And yeah, I just want to comment on that time frame. And it's something we've noted before, but it's worth noting again, is that because of the CARES Act, and because of some of the decisions we need to make with the CARES Act, we have to, I think, accelerate some of that time frame. And at the same time, I mean, so for example, potentially this coming Monday night, you're going to ask us to vote on AO 2020-66. Maybe that'll get postponed. But how could we vote on that and commit up to $7 million? And this is like worst case scenario. Let's say we had to commit $7 million of alcohol tax funding if we pass that on that Monday night. Then we're going to have a week and a half later town halls asking people what we should vote on, what we should spend it on. Well, we've already committed the majority of it. And so I don't know. I feel like our current planned time frame is sort of running up against reality right now, and it's not working very well, or it might not work very well.
Thank you. Ms. Zolotel?
Thank you. I guess I would encourage members to go back and look where we've put in the various proposals operational costs for these buildings kind of built in. But back to the slide, Felix, that you showed, I liked, and to wrap back to Celeste's comments, I like that we're going to have some time to sit down with tribes. I'm wondering if there's a way to do that. And I know we're all stretched on time, but we should be doing that with some other community groups. I don't know if it makes sense to do that through committee, whereas like the Committee on Homelessness, we could take and go back and make sure we've definitely checked in again with the Houseless Resource Advisory Council and split it up committee-wise or something else. But I do want to do that. I appreciate the work of Recover Alaska and being able to convene those stakeholders, but for us to be able to be there, I think is really important. So we're hearing the information, but it's that tension with time that we've talked about all day over and over. So I just wanted to flag that opportunity perhaps, and if we can maybe try to figure it out.
Thank you. So I'm in the queue again, just two follow-ups just based on Mr. Dunbar and Ms. Zolotel's comments. So Mr. Dunbar, if you were to imagine a timeline that was quicker than what was proposed, what would it be?
Well, I think we need to have a conversation not just about the timeline of the comments we receive on the alcohol tax. I actually think your time frame of having the two town halls very soon, I mean, on August 4th and August 6th is a good one. I think it's more about AO 2020-66 and the commitments there, and whether or not Monday is the time we should be passing that, or if it needs to be passed in concert with a broader package that involves COVID relief and probably is subsequent to us having those town halls. And perhaps that week of the town halls, we should also be doing some of the other meetings you're talking about. I think that is where my head's at right now. But I'm not wedded to that. And perhaps on Monday I'll be talked out of that. But some of the proposals, like the Mental Health Corps, for example, rely on CARES Act money for a startup and then alcohol tax money going forward. And so we have to have that simultaneous conversation. But that's going to be short-circuited if you have everything just basically wrapped up on Monday night.
Got it. Thank you for clarifying that, Mr. Dunbar. That was helpful. And then I guess second to Ms. Zolotel's comment, and this goes to Ms. Hall, Ms. Hodge-Grouden, and then Dr. Monsager. So would you be willing and able to assist us in convening meetings where we can talk with the various entities and groups about the alcohol tax.
Hi, am I on mute?
There.
Oh, hello?
Go ahead, Celeste.
No, you go ahead. I wasn't sure who was supposed to answer.
I think maybe it was posed to all of us. This is Tiffany. Yes, we would be happy. I'm speaking for myself, but I would imagine that the rest of our coalition would be happy to try to help get more voices in the room, and I appreciate the ask.
I'm pretty sure, this is Dick, I'm pretty sure some of the HLC members would be interested in meeting with some of the assembly if you want to do that.
And then just want to leave space for Ms. Hodge-Growden if you wanted to respond as well.
Oh, absolutely.
Great, thank you. All right, so then a lot more work to do, and I invite some of my colleagues to assist in these efforts. But I will go ahead and put my thinking cap on the process moving forward as suggested by my colleagues. And unfortunately, this is the end of this work session, and I will see everyone in a few minutes at the 2:40 meeting.
Thank you.